Epidemiology deals with a study of how often diseases occur in different groups of people and why those diseases occur. For an epidemiologist, understanding how diseases spread is very, very essential. Epidemiologists must learn about diseases, what makes populations susceptible to them, and how they move through populations, and what allows them to survive and to thrive. And in this way, epidemiologists effectively study and fight the spread of diseases. Epidemiologists' first concern was to investigate, to control, and prevent epidemics. The term epidemiology is derived from the Greek word which means epidemic. Now, epi means among or upon, and demos means population or people. Logos means scientific study. Therefore, we can describe epidemiology literally to say it means the study of what is upon the people. But I like this definition of epidemiology, which says epidemiology is the study of the distribution and determinant of health-related state and event in specified population and the application of this study to control community health problems. So let me try to break down this definition of epidemiology so that you can have a general understanding and overview of what epidemiology is all about. The first key component of the definition that I want us to talk about is study. Epidemiology is the study. Now, study means a systematic collection, analysis, and interpretation of data. Therefore, epidemiology involves collection, analysis, and interpretation of health-related data. In epidemiology, we want to collect data about diseases. We want to analyze data about diseases, and we want to interpret data about diseases. So therefore, epidemiology is a science. The second component I want to talk about is the frequency. Epidemiology deals with the frequency. Now, frequency means the number of times an event occurs. And we see that epidemiology studies the number of times a disease occurs. Now, this means that epidemiology answers the question, how many diseases do we have? Epidemiology is therefore a quantitative science because it deals with numbers. The third key point I want to talk about is distribution. Distribution means how a disease or health-related event is spread across a population. Epidemiology, therefore, studies the distribution of diseases by person, place, and time. By person, we want to know who is affected by this disease. Is this disease affecting males only or females only? Is this disease affecting children, adult, or old people? Or this disease is not choosing the gender? Okay, males, females are affected equally. We want to know. Epidemiology also studies the distribution of disease by place. We want to know the location. Why is this disease? Why is cholera? Why is it dysentery? We want to know the location. Or it is in this district. It is in this province. Apart from that, epidemiology studies the distribution of diseases by time. We want to know the incubation period of that disease. We want to know the time that disease is likely to occur or is likely to strike. That is very important for an epidemiologist. It answers the questions, who is affected, where is the disease, and when is the disease likely to strike. So therefore, we can put it in this way to say epidemiology describes health event. The other component I want us to talk about is determinant. Epidemiology deals with the determinant. Now, determinant means the presence of factors which affect and cause the occurrence of diseases or health-related events. In simple terms, determinant are risk factors, determinant are causes. So epidemiology studies what determines health event. Epidemiology studies what causes diseases, communicable diseases, non-communicable diseases. If we find out that there's an outbreak of cholera, epidemiology deals with what is causing that cholera. What is the causative agent? What are the predisposing factors? That information is very, very vital in order to come up with the preventive measures of that particular infection. Epidemiology aims to find or to identify factors that contribute to the development of a disease, including lifestyle choices, environmental exposure, and genetic predisposition. So we can say epidemiology answers the question, how the disease occurs and why it occurs in the first place. What factors favor this disease to thrive? Point number 5, epidemiology deals with diseases and other health-related events. Epidemiology is not only the study of disease. The focus of epidemiology are not only patient, but it studies all health-related conditions or all health-related events. So therefore, epidemiology is a broader science. The other component is human population. Now, this means that epidemiology diagnoses and treats communities and or populations. Clinical medicine diagnoses and treats patients, whereas epidemiology deals with the populations, the communities. Epidemiology is a basic science of public health that studies the spread of disease and other health-related events in populations. So it helps prevent the spread of disease and improve health in communities. The last point is application. The reason why we are studying this disease is to apply the information in order to come up with the practical preventive measures. So epidemiological studies have direct and practical application for prevention of diseases and the promotion of health. So epidemiologists develop interventions in order to prevent the illness from spreading and coming back. So epidemiology is therefore a science and a practice. It is an applied science. So as we collect this data, as we analyze this data, as we interpret this data, as we study diseases and the transmission of diseases, we want to use this data in order to come up with the preventive measures that will help to prevent disease in the community. So this is what we mean by epidemiology, or this is what we mean when we say epidemiology is the study of the distribution and determinant of health-related state and event in a specified population, and the application of this study to what? To control community health problems. I believe this definition makes sense now.